My name is Stefano Cotrufo and I'm a plastic surgeon in central London, Harley Street. Cases where the combination of liposuction and deep plane facelifting has a very strong indication. Specifically, I will use the VASER Liposuction for the neck. The reason is that here we want to improve the cervicomental angle by both reducing the thickness of the fat layer, but also to reduce the excess skin, so bringing the skin towards the ear. Consistency of the fat in these two pockets is particularly dense. I think that the traditional liposuction with the tumescent technique is not going to be enough in order to give a result as smooth as I usually achieve with the VASER. And that means that once then we use the deep plane, so bring the platysma backwards, and we'll make sure that there is no residual fat density in those areas.
So I'm here today to have rejuvenation on this neck and my jawline. I have a lot of extra skin that sometimes you can't see, but then if I relax, there's just a lot more, and I'd like a more defined jawline. I found out about Dr Cotrufo through a friend. He did a very good job with her, and she really recommended him and the surgery and the care that was given here. I've had loads of information regarding two different types of procedures that I could have had, given me options, the pros and cons to both. All of my questions were answered and more, and I feel comfortable that I've made the right decision for the right procedure with the right doctor. Everyone's been really friendly and helpful and patient, which is good for me because I like to check and check and check again. So yeah, I've really enjoyed my experience. It's been very comfortable.
This is the inferior edge of the dissection. This is the pocket that we will be dissecting with the VASER, the inferior pocket, and that's the superior pocket. Then obviously we'll keep going with the dissection in both directions between the platysma and the skin. In this case specifically, the indication to open the neck is that the left platysma is much stronger, creates a band that is quite thick. If you could show me your lower teeth, can you see? So let's say that this muscle is way stronger and is also thicker, while on the opposite side she almost doesn't have any platysma band. So the solution here would be to do a small incision underneath the chin. Can you relax? Thank you. Underneath the chin, it is about 2.5 centimeters, and then from here expose the platysma band. Can you show that to me again? There you go. 1 and 2, and stitch it to the opposite side. It should be more or less at this level. So by tacking this muscle layer together, you can also prevent there is any recurrence. We need to work in this direction here. So in this case, I'm combining VASER liposuction to the lower face and upper neck, as I described before, with a deep plane approach to the neck and the lower face. And the reason why I decided to combine this procedure for the first time is because this young patient has very solid fat deposit on the lower face, in particular on the submental area and over the cricod. And with the VASER I can achieve a smoother result. Well, instead the mid-face is collapsed over the lower face because she has an underdevelopment of her mandible. So the solution here would be to reduce the fat volume and simulate some skin contraction with the VASER, but instead the deep plane approach will give her lifting of the soft tissue, and so to describe better the jawline. And it's very interesting that I had the chance to operate this case now, because in March I'll be presenting this case at the Carvara Conference in facial plastic surgery from Professor Michele Pascali. So this is the 1 hour and 20 minutes following the beginning of the surgery. We completed the neck dissection with the VASER liposuction. We entered the deep plane from the standard facelifting approach and behind the ear. And now we are dissecting the platysma. So The next step will be to fix the plane into a higher position, and then we move to the opposite side. This is the end of the first side. After 1 hour and 40 minutes, we dissected both sides of the neck and completed the deep plane fixation at this level. You can see where the sutures are, 1, 2, and 3, they're quite deep. Now the next step will be to reposition the skin. And for the patient that had a 2 double chin, and now we have a much nicer silhouette already. What you see here bulging is the drain, which is the tube that runs all the way through. But this is a very nice contouring. And so this is the end of the fixation of the deep plane to the parotid fascia at this level of the mastoid area. As we were saying earlier on, it's essential that the suture of the skin happens without any tension. And here, in fact, the suture is not done yet. This is still open and needs to be stitched together. But as you can see, the two skin edges are kissing. And that's the reason why we expect the scar that disappears over time. There's only the reconstruction of the tragus here, which is very natural. And now we go on the opposite side by tackling the platysma at this level and then completing the deep plane on the opposite side.
Thank you very much for watching this video. I hope you find it useful. And please don't forget to follow me on Instagram in case you wish to know more about my plastic surgery service, and in particular if you wish to see my results, which of course I'm very proud of.